Hello, my name is Gabby Aguilar, and I am introducing my PowerPoint for my capstone project, and that's in reducing cesarean delivery surgical site infections. Learning objectives. Discuss surgical site infection after cesarean deliveries. Discuss rationale and the purpose of chlorhexidine gluconate, also known as CHG. Discuss the background and the significance of CHG, the bathing solution, and the washcloths in obstetrical patients. Present the problem statement. Present literature associated with CHG, specifically in cesarean deliveries and surgical site infections. Describe the implementation of CHG. Describe the evaluation of CHG, the limitations and barriers of CHG, the dissemination approach, and finally the summary. Surgical site infection defined. So an infection that develops in the area of the body where surgery was performed is known as a surgical site infection, SSI. So they can be superficial infections, only involving the skin, or they can become more serious, affecting organs, implanted materials, or subcutaneous tissue. According to the United States Centers for Disease Control and Prevention classifications, postpartum endometritis, which is like a womb infection, and skin incision, the wound infection, are the most prevalent types of infections that occur after a cesarean delivery. Rationale and purpose. So the purpose of this emerging issue is to lower the likelihood of SSIs in cesarean deliveries. This is important because it places such a big burden on the patient and the hospital system itself. SSIs in cesarean deliveries are linked to readmissions, hospital quality score and performances, extended hospital stay, increased hospital cost, increased patient cost, unfavorable health outcomes, and delayed return to daily activities. Background and significance. So chlorhexidine gluconate, CHG, is a widely used antiseptic in the healthcare setting. It is very well known for its remarkable safety profile and wide range of activity. So cleaning patients' skin with this liquid or foam CHG preparation, which can be left on, washed off, or used with impregnated CHG washcloths, is a typical bathing routine. So this antibacterial layer that is produced by chlorhexidine gluconate's binding to the stratum corneum of the skin is renewed after every bath. So research indicates that the use of these impregnated wipes or bathing solutions containing CHG has decreased surgical site infections by decreasing the amount of microbial flora. This is significant because, as we discussed, it causes readmissions, and these readmissions require frequent blood work, IV antibiotics, IV fluids, analgesics, and wound care services. In some cases, a wound vacuum assisted device is placed to promote faster wound healing. This can be expensive, and it requires case management to set up home health care and medical supplies. Problem statement. This is my problem statement in PICO format. In obstetrical patients undergoing cesarean deliveries, how does the usage of impregnated antiseptic CHG wipes and bathing solution compare to no usage of impregnated antiseptic CHG wipes and bathing solution affect patient outcomes, readmissions, and hospital cost? Literature review. In the US, there were about 1.3 million cesarean deliveries in 2016. Cesarean surgery is linked to a 5 to 20-fold increase in postpartum mortality and maternal morbidity from infections as compared to vaginal deliveries. SSI primarily due to skin microbial flora, is the most common post-cesarean delivery complication. It affects 2 to 15% of women, and it plays a significant role in maternal morbidity and mortality. A total of 19,793 patients that had a cesarean delivery were included in a study. Of them, 32, which is 0.16, had an SSI during the hospitalization during their cesarean delivery, and 322, which is 1.63%, had SSI after discharge, and within 30 days following the cesarean delivery, a total of 1.79%. Those who developed an SSI during their hospital stay had substantially higher length of stay, so 5.6 versus 3.3 days. The associated expense of endometritis and wound infections for each affected woman was $3,700 and $4,000, respectively. Literature continued. The CHG was first introduced in the 1950s. It has been extensively utilized in healthcare. This is mostly due to its broad spectrum activity, which includes both gram-positive and gram-negative bacteria, as well as exceptional safety record, which includes a very low number of documented occurrences of hypersensitivity and anaphylaxis. Individuals undergoing systemic antibiotic prophylaxis for the purpose of reducing surgical site infections following a cesarean delivery fared better with chlorhexidine alcohol preoperative skin antiseptic solution than just with iodine alcohol. A different study found that an SSI preventative care bundle reduced SSI and 3 unfavorable outcomes, which include sepsis, reoperation, and readmissions. A full body preoperative wash using 4% CHG cloths, surgeon hand scrub retraining, surgical prep retraining, and wound care education for patients were all included in this bundle. That's why it is so important in selecting and utilizing the appropriate antiseptic for skin preparation. It becomes one of the most important steps in SSI prevention. Implementation. To implement any change, it is necessary to have a solid justification. Thus, the first step would be to collect data regarding the problem and evidence that supports the proposed change. Obtaining and presenting this research directly related to cesarean delivery surgical site infections to the obstetric team, which consists of directors, nurses, leaders, and providers, will increase the likelihood that this intervention will be put into practice. Next, the nursing staff will receive an overview of the policy and its justification. A method to communicate this knowledge is by employing educational modules to educate nurses about CDSSI. As with every other organizational instruction, there will be an assessment to make sure that the content was learned. Additionally, hands-on training sessions will also support the methodical application of CHG wipes to avoid contaminating clean areas, for example, using one wipe to clean each limb and trunk. Evaluation. So in order to evaluate the effectiveness of using CHG wipes and this bathing solution in cesarean deliveries, every 3 months, the hospital administration will track readmissions related to cesarean delivery surgical site infections. Additionally, the hospital charges will be obtained to get an estimate of the overall costs. Auditing the electronic medical records for using the CHG wipes and bathing solution will help to ensure compliance. Finally, every 6 months, nurses and patient care technicians must complete CDSSI modules and hands-on checkoffs. Limitations and barriers. The two most prominent limitations and barriers would be compliance and imminent deliveries. For example, patients that come to us with complicated obstetrical challenges, nurses have really little time to execute this intervention when delivery is imminent because the patient is urgently transferred to labor and delivery. At that point, keeping both the mother and the baby safe is our priority. In these situations, the suggested intervention can begin as soon as the patient returns back to our unit. Dissemination. Presenting this information at the Association of Women's Health, Obstetric and Neonatal Nurses, AWON, annual convention would be one of the finest ways to spread awareness of this technique. Every year, directors, executives, nurses get together to talk about how to enhance patient outcomes. As such, bringing this topic and all of its relevant data can be a terrific place to start when working toward change. Summary. According to research, reducing the quantity of microbial flora, the use of impregnated wipes or bathing solutions containing chlorhexidine gluconate has reduced surgery site infections. SSI is of utmost importance since it burdens the mother and the medical system greatly. Identifying and putting into practice the evidence-based technique of utilizing CHG solution to stop and lessen SSI following cesarean deliveries will improve maternal outcomes. It will reduce readmissions, and it will cut hospital costs.